everyone, and welcome to our discussion focused on exploring personalized medicine in multiple myeloma. I'm Mary DeRome, Senior Director of Medical Communications and Education at the Multiple Myeloma Research Foundation, or MMRF.
Hi, everyone. I'm Kristen Hege. I'm the Senior Vice President of Early Clinical Development for Hematology, Oncology and Cell Therapy at Bristol Squibb.
Hello, my name is Anna Truppel-Hartmann. I work at 2seventy Bio as a Vice President in Clinical Development Oncology.
Even though multiple myeloma is considered a rare disease, it is the second most common form of blood cancer in the US, consisting of 1.8% of all cancers. And although there are many effective treatments now in use, there remains still a critical unmet need in treatment options for patients who do not respond to or may relapse from prior treatments. Today, we will discuss the emergence of personalized medicine in multiple myeloma, examples of what this type of treatment might look like, and the role that it can play in the multiple myeloma treatment paradigm. Personalized medicine is really in its infancy at this point, and it really has not been that long since the first personalized medicine was developed. And this is really just now coming into myeloma. So what we're trying to do is really personalize treatments for patients based on their own characteristics, whether they're genomic characteristics, whether they're immunocharacteristics, whether they're their age or certain comorbidities or diseases that they may have alongside of multiple myeloma. So these are the frontiers of personalized medicine emerging in multiple myeloma. And the goal of this type of therapy, I think, is to bring patients therapies that are going to work best for them. And this has always been a goal of the MMRF, because we know that multiple myeloma is not a single disease, but it's really different in every patient.
I'm actually a treating physician, and I see patients in my clinic with blood cancers. And, it's very true. No two patients are the same. They come with different, comorbid diseases, different social circumstances, on top of their tumors, which are often genetically unique. So it's so important as we move forward in the treatment of this disease that we tailor each treatment to each individual patient, their personal circumstances, their medical circumstances, and their tumor biology. I think personalized medicine is a goal in the treatment of oncology overall, and myeloma is no exception. As I mentioned, every patient has unique genetic factors in their tumor that determine their prognosis, their overall risk, might determine their sensitivity to the increasing number of treatment classes in multiple myeloma. In addition, they have their personal circumstances in terms of how easy it is for them to come to the clinic to get infusional therapies, oral therapies, their support network, their comorbid diseases. So I think we're all really striving to bring the best treatment to the individual patient based on their individual tumor and personal and medical characteristics.
I think before we only could treat the patient because of the myeloma disease, and now we have also more information and more tools available to assess the individual disease of a patient. And I'd like to reiterate, no patient is the same than the other patient. So it's very important that we are looking at all the different characteristics. We are looking at the tumor characteristics. We are looking at the patient's settlement and what is the need for the patient, and also the previous therapies the patient has received. So I think absolutely it's very important also with coming research that we are targeting even further the treatment to the individual patient.
So genomics in multiple myeloma is something that the MMRF has been working on for a number of years. And we were the first organization to fully sequence the myeloma genome, and that was 10 years ago now. So our subsequent work, sequencing the myeloma DNA of over 1,100 newly diagnosed myeloma patients in our COMPASS study, and we're following them for 8 years, this has really helped define at least 8 to 12 myeloma subtypes. And high-risk disease is a very important subtype that we're working on quite hard right now. And this has underlined the fact that myeloma is different in every patient. And because of this, patient data needs to be gathered and widely shared in the research community in order to help find a cure for every patient. So genomics is really critical, and we are beginning to see a lot more emerging therapies that are based on DNA mutations or changes that appear in the cancer. And these changes actually may be not only in myeloma, but in other cancers. So we are seeing the emergence of certain therapies that may already be approved in other cancers, actually moving into the myeloma space in clinical trials to really see if these targeted therapies that go right against a certain gene will actually bring benefit to a myeloma patient. And we have a trial called My Drug that is actually testing that theory.
To gather the data that we are requiring to understand the profile of individual patients of myeloma and see and compare through that databases what we can evolve the research on. And so I think that's a really great effort from the MMRF to really understand the patient profiles.
So one of the important ways that genomics can help find better treatments for myeloma patients is really by looking at large data sets of patients, looking at their genomics and seeing what types of genomic alterations they may have, seeing what types of therapies they took, and determining whether or not those therapies actually helped that patient or did not help that patient. One of the things in myeloma that is of great concern is that there are many, many different types of therapy and also combinations of therapy. And sometimes it can be very difficult to find the right therapy course for every patient. So this is why it's so important to gather this type of data so that you can have a database, look at the genomic characteristics of a patient who may look like a patient who walks into your office if you're a doctor and say, okay, here in this database, we have a patient who has similar genomic characteristics and other demographic characteristics. They took this type of therapy and they had a really good outcome. So we may be able to utilize that type of therapy for your disease as well, and it could give you a better outcome. So really the idea is to make sure that each patient is getting the right therapy for their disease, which certainly will mean that it's more effective and there's fewer toxic side effects, hopefully.
Yeah, no, those are great points, Mary. And one thing I would add is, we have the luxury of these huge amounts of data now that we can get from genomics. And the challenge of large amounts of data is you need large databases to draw meaningful interpretation. So, the work that's being done at MMRF to just build these massive genomic databases to start to tease out the subtle differences in myeloma biology based on the different genetic profiles is going to be incredibly informative, especially when you can then link those genetic profiles to outcomes with different treatment interventions. So I think the potential for this is really exciting to enable what we're all hoping for is this personalized approach to the treatment of myeloma, and also over time, because there are a lot of treatments and the disease probably evolves over time. And so we need guidance, with each round of therapy.
So there are ways, for example, where we are using immunotherapy. And immunotherapy is a way of interfering with the patient's immune system to enable the immune system to attack the tumor or its molecules. And for example, there is an option for that has been developed over the last years, where patients' own cells are modified. Own T cells are modified and reinfused into the patient's body so that they can attack the tumor better. And so the T cells are a part of the immune system that normally are able to also see the cancer cells. But the problem is through the evolution of the tumor, these tumor cells evade the T cells. And by now taking these T cells from the patients and modifying them the way that they can then find the target antigen on a tumor cell is called CAR T cell therapy that enables the immune system to attack the tumor. So that's kind of a recent advancement with regards to personalized therapy.
And Anna, I'd love to add to that. We started the conversation talking about the genomics of the disease and how that might guide personalized therapy. And now we're moving on to another version of personalized therapy, which is using the patient's own immune system, their own T cells, genetically retargeting them outside of the body and then reinfusing them to target and kill their myeloma cells. So this is truly personalized. We're making the product for each individual patient with their own T cells. So that is a very exciting area of drug development and research and treatment now for patients with multiple myeloma. CAR T cells are a living drug. The cells are alive, so they persist after a single infusion. So a CAR T cell therapy is given as a single infusion, and then over time, those cells expand and then contract and persist to varying degrees in the patient. So let's dive a little more into how these personalized CAR T cell therapies are made. First you filter the T cells out of the patient using a standard apheresis procedure at a hospital. Those cells are then shipped to a central manufacturing facility. The cells at these manufacturing facilities are then isolated, and they are genetically modified to express a receptor that targets them to kill the myeloma cells. And after expanding those cells and freezing them, they are thawed and infused into the patient. And then the patients are monitored closely after that for 4 weeks to manage them for the known side effects, including things such as immune activation. We refer to that as cytokine release syndrome, some other neurologic toxicities. Most of those toxicities are observed in the first month after the CAR T cell infusion.
And I think it's important to note as well that while this therapy does seem to work pretty well for a number of patients, it certainly is not a cure, and it does not work for every patient. And there are certainly significant side effects that are associated with this type of therapy. So this is really something that if patients are interested in, they really need to talk to their care teams to see if it's something that might be appropriate for them.
That's a really good point. And I think, we all appreciate treating cancer is difficult. And generally, not all cancers respond to any given therapy. So the deep genomic translational data that we're getting from the thousands of patients that have been treated in this first wave of CAR T cell therapies for myeloma, we're very optimistic that this can guide and inform the ongoing discovery and development of this.
Exactly, Kristen. What I'd like to add as well, going back to the beginning, myeloma is unfortunately still a non-curable disease, and we're trying all the efforts with what we have been discussing on the genomics and the personalized medicine to really bring future therapies available for patients. So, and I think the ultimate hope is really to make multiple myeloma as a curable disease, and that's exactly why we need to work on this. All these aspects of the therapeutic advancements.
So again, it's really the immune landscape plus the genomic landscape that I think will really move the field forward in a more predictive manner as we begin to catalog and put in databases this data on what these landscapes look like in each patient and how well therapies have worked for them.
Who would have thought 20 years ago that we take cells and change them, modify them, that they can attack a cancer? I think no one would have thought that if 20 years ago, that we will be able to manufacture such cells and be able to also treat the patients. I think the second point that I'd like to mention here is I think it's a wonderful solution to take the patient's own cells. So it's a very targeted therapy, to a very individualized therapy. Every patient receives its own drug product. So we are taking the cells from the individual patient and giving it back to the same patient.
There's so much excitement and so much investment and so many smart physicians and scientists and clinical investigators working on this that I'm very optimistic about the progress that we're going to make over the coming years and sort of the speed of the science and what exciting opportunities this affords for patients with myeloma and other blood cancers.
Personalized medicine is really going to become the medicine of the future. So I know that as an organization, the MMRF right now is beginning a brand new study called the Cure Cloud, where we hope to enroll 5,000 patients. So in this study, we're actually offering patients who have active myeloma the opportunity to have genomic sequencing done on their blood. So it's a blood biopsy. And at the same time, when they consent to the study, we also collect all of their clinical information from all of the doctors and centers where they've been seen. So their myeloma DNA that is circulating in their blood is sequenced, and that sequencing information, again, looking for changes in the DNA that might shed some light on their personal subtype of myeloma, as well as their clinical information. Those two pieces of their myeloma, the genomic and the clinical, are put together in a large database. So this type of information, all gathered together in a very large database, will be available to all researchers, all patients, all doctors will be able to go into the database and look at all of this information. So I think that as we move forward and collect more and more of this type of data, and then including the immune landscape data as well, it will become for myeloma patients hopefully easier and easier to find something that will work for them and work for them well earlier in their disease. And I think that's the hope of the myeloma community and where we're all trying to get to.
Mary, that's great. It's really exciting to hear about what MMRF is doing in terms of both these genomic and immune databases, over the course of a patient's treatment journey. In addition to that, I think I'm very excited about the continued progress in the area of cell therapy as a form of personalized medicine for multiple myeloma. The genomic data and other immune landscape data might help to inform which patients should receive these therapies earlier in their disease course. We've talked about combination therapies. How do we deepen the responses, make the responses more durable through combination therapies, with cell therapy being part of that combination. And then finally, the next generation, we're just starting here, although I have worked in this field for 25 years, Anna, and we did think about CAR T cells back in the 90s, the real progress is being made now. And so the acceleration of that progress, next generation engineering to tackle all of the existing hurdles, to overcome the mechanisms of resistance to these current generation of cell therapies.
Yes, to add on what you said, Kristen, I couldn't agree more. There are so much we can do to further improve the cell therapy space, and I'm very excited on working with the community and everyone to bring that space forward. We need to have more therapies available to really target these therapies to the individual tumor. I think that's one thing that I'm very much looking forward to address, and I really appreciate all the efforts that MMRF is doing in this regard.
It's really important for patients and their caregivers to learn as much as possible about treatment advances. Certainly now that the myeloma community has entered the era of personalized medicine, and we all know at this point that cancer treatment and myeloma treatment is not a one-size-fits-all approach. So that personalized medicine is going to bring that personalized approach to each person's therapy course. And with all of the great work that's being done in the myeloma community, there's more hope than ever that even more effective therapies with fewer side effects might be right around the corner, thanks to everyone's hard work.
Thank you, Mary and Anna. This has been such a valuable conversation. I really appreciate you both sharing your insights on personalized medicine in multiple myeloma and everything that's happening at MMRF, in the science and medicine and development of these novel personalized therapies, as well as the collection of this important genomic and immune landscape data that is going to inform the future of these fields.
Thank you very much, Mary. Thank you very much, Kristen. This was such an important conversation, and I took a lot of insights also with me. I also think it is very, very important to work together as we do today, have this conversation, but also work together to improve the science and the advancements in the treatment of multiple myeloma. I also do believe we need to educate ourselves. We need to inform what we have found to make personalized medicine in myeloma happen.
Absolutely. Anna, Mary, it's been a real pleasure. Such an important topic. It's been really fun to have this conversation with both of you.
And also, thank you to everyone out there watching. If you want to find out more information related to our conversation today, please visit the MMRF.org, myelomacentral.com from Bristol Myers Squibb, or 270bio.com. Thank you.